Top 10 warning signs of inflammatory bowel disease. Hey viewers, you may have heard of inflammatory bowel disease or IBD, but did you know up to 3 million Americans are diagnosed with some form of IBD? Our body can signal us warning signs and symptoms of inflammatory bowel disease, but without knowing what they are, we may overlook our body's important messages, leading to delayed treatment and opening up more risks of life-threatening complications like colorectal cancer. Do you often feel bloated or tired? How can your poo signal red flags on what's happening from within? We'll be uncovering all this and more so you can catch potential issues before it's too late. First, we need to understand inflammatory bowel disease primarily branches out into two main types. The first type is ulcerative colitis, which involves inflammation and ulcers in the lining of your large intestine and rectum. The second type of inflammatory bowel disease is known as Crohn's disease, a condition known for the inflammation of the digestive tract lining. It predominantly affects the small intestine, but sometimes extends its reach to other parts of the digestive system. Both conditions are linked with these 10 signs and symptoms that we'll be breaking down. Number 10, abdominal pain. One of the most telling and often the first signs of inflammatory bowel disease is persistent abdominal pain. It's often in the form of a dull, cramping ache or even sharp pain that arises from deep within your belly, causing interruptions in daily activities and sleep patterns. This pain isn't just your typical stomach ache from a heavy meal. It's more pronounced and frequent, making it a clear cause for concern. Wondering what's triggering such abdominal pain? The discomfort originates from the inflammation and ulceration inside the intestines. As the lining of the digestive tract becomes swollen and develops ulcers, it results in this painful sensation. So persistent abdominal pain, especially when combined with other symptoms, could be your body's way of signaling something serious like IBD. Number 9, diarrhea. While often thought of as a minor ailment or aftermath of something you ate, diarrhea can signal a more significant red flag than many realise. With inflammatory bowel disease, frequent bouts of diarrhea are a consistent and troubling symptom. The inflamed tissues of the intestines can interfere with the absorption of water, nutrients, and the passage of stool, leading to loose, watery, and sometimes even urgent bowel movements. If you're finding yourself making constant unplanned trips to the bathroom, especially if it's disrupting your night's sleep, it's time to take note, as it may just be a warning sign of inflammatory bowel disease. Number 8, gas and bloating. With inflammatory bowel disease, gas and bloating aren't just one-off incidents. They become persistent companions. When the intestines are inflamed, they can struggle to process and break down foods properly. This can lead to an overproduction of gas, resulting in that bloated feeling and frequent passing of wind. The inflammation can also cause a slow movement of the intestines, allowing gas to accumulate and cause discomfort. If you're noticing that your abdomen often feels distended, tight or painful, and you're releasing more gas than usual, it's not a minor inconvenience. It's a potential sign of an underlying condition. Continuous gas and bloating, especially when seen alongside other IBD symptoms, should be a sign for you to consult a medical professional. Number 7, mucus or blood in stool. A glance in the toilet after using it might not be your first instinct, but it's a habit that could provide vital clues about your health. If you notice mucus or blood in your stool, don't dismiss it. With inflammatory bowel disease, the inflamed and ulcerative tissue can shed mucus or bleed, making its presence in the stool. Blood might appear as bright red streaks or a darker, tarry consistency. Either way, it's a clear indication that something's not right and warrants immediate medical attention. It's a huge red flag signaling that your body needs further evaluation. Number 6, fatigue. Beyond the regular tiredness we feel after a long day, fatigue is a significant symptom that's linked to inflammatory bowel disease. That deep exhaustion that doesn't seem to go away even with adequate rest can be due to the body's constant battle against inflammation or nutrient malabsorption, leading to anemia. If you find yourself constantly lethargic, struggling to get through the day, or needing more rest than usual, it's a sign you shouldn't ignore. Number 5. Unexplained weight loss. Shedding a few pounds might seem like a win for many, but when it's not planned and without a clear reason, it's time to raise an eyebrow. Inflammatory bowel disease can result in reduced appetite, malabsorption of nutrients, and increased metabolic demands due to inflammation. And all these factors can contribute to sudden and unexpected weight loss. So if you're losing weight without trying, especially if you're also experiencing other symptoms, it's a telltale sign that you should consult with a medical expert. Remember, weight loss isn't always a victory. Sometimes it's a cry for attention. Number 4. Iron deficiency anemia from blood loss. Pale skin, fatigue, and shortness of breath might be symptoms you'd overlook, but they can be signals of iron deficiency anemia, especially in those with inflammatory bowel disease. When the intestines are inflamed, intestinal bleeding can occur, leading to a slow but consistent loss of blood. Over time, this blood loss can result in iron deficiency anemia, a condition where your body lacks enough red blood cells to transport oxygen effectively. If you're seeing signs of anemia, it's important to connect the dots and consult with a healthcare provider. Number 3. Fever. A raised temperature is often the body's SOS signal, indicating that it's fighting off something. With inflammatory bowel disease, low-grade fevers can become a frequent visitor, indicating ongoing inflammation or, in more severe cases, a possible infection or complication. If you're experiencing unexplained fevers, especially alongside other IBD symptoms, it's a sign that your body is in distress. Instead of reaching for the thermometer or a Panadol like most would, reach out to a healthcare professional and get to the root cause. Number 2. Loss of appetite. A sporadic loss of appetite might be due to stress or mood, but if you're consistently eating less than usual, it may indicate something severe. With inflammatory bowel disease, the inflammation and discomfort in the digestive tract can lead to a decreased interest in food. You might also notice your body can signal feelings to avoid eating, so it can prevent potential pain or discomfort that follows a meal. If you find your hunger cues diminishing or meals becoming a chore, it's essential to recognize this as a potential warning sign of IBD and seek guidance from a healthcare specialist. Number 1. Joint pain. Joint pain is another common symptom of inflammatory bowel disease. The inflammation from the bowels can sometimes travel and affect other parts of the body, especially the joints. Because of this, it can lead to arthritic symptoms and cause movements to become painful or stiff. If your knees, wrists, or other joints are suddenly aching without a clear cause and it's accompanied by digestive issues, it's a potential red flag for inflammatory bowel disease. By understanding these warning signs of inflammatory bowel disease, you're armed with the knowledge to decipher your body's signal for early detection and taking action immediately to prevent from further severe complications. If you've learned a thing or two about the warning signs and symptoms of inflammatory bowel disease, you'll also want to check out these other helpful videos. We'll see you there.